And we're happy to be continuing this segment here for your mental health on First at 4. We want to welcome in Holly Swope. She's with Barber Behavioral Center with us to talk about children's mental health. But welcome into First at 4, Holly.
Thank you so much. It's nice being here.
We thought that was such a poignant story ahead of you, that story of perfectionism in kids and how it can be very anxiety inducing for many, many kids. Talk a little bit about the state of our youth's mental health today.
Well, especially since the pandemic, you know, it can be very challenging for some little ones and all the way through their teenage years, struggling with some, you know, just isolating themselves and having positive peer interactions and socialization and getting out there. So it can lead to, you know, depression, anxiety, things of that nature, some problem behaviors. So.
And I can think social media, we talk about this a lot, but how social media affects our kids and that the ideals that are put out there, the communication between young kids that perhaps parents aren't monitoring.
Right, or aren't aware that their kids are being exposed to.
Right. Yeah, definitely. It's a big concern with social media, and just, you know, to have that parent or caregiver monitor the usage and, you know, maybe putting a time restriction on it and, you know, and encouraging them to get out and maybe involved in some clubs or organizations. And if there are any concerns with mental health or behavioral health concerns, they can always get a psychological evaluation. If they think it's out of the norm or typical behaviors, they can always pursue something of that nature.
What are some red flags for parents to be aware of?
Yeah, so there's some that are for younger children, like maybe lack of verbalization, just that those functional communication skills might not be there. There may be a delay. Also some problem behaviors like tantrums, aggressions, self-injurious behaviors. Maybe they're hitting themselves, biting themselves, cutting themselves. So anything of that nature, and once again, the isolation, you know, not interacting very much with other peers. So any of those would be some signs that maybe a psychological evaluation or some testing, you know, would just provide some clarity.
Yeah, and as parents, I think it's hard. You don't really know what you're doing, you know, the first time around. So if someone is starting to see some of these red flags or some of these behaviors, where do they start? I think it can kind of be overwhelming for moms and dads.
Yeah, definitely. So the first thing would be to get that psychological evaluation. At Barber Behavioral Health, we do offer that, as well as other agencies throughout the area offer that too. And that provides some insight into maybe a possible diagnosis or diagnoses, and then recommendations as well to be able to pursue after that. That might be of assistance. Also, if the child is of school age, there's always the guidance counselor. There's always a SAP counselor as well that would provide assistance to avenues for further help, like therapeutic help, behavioral help.
Yeah, my thought is, you know, what if it's not, you know, the kid just needs an outlet to kind of talk these things through. Are those kind of resources available? Yeah,
so there's always an outpatient therapy like that where, you know, the child would go to somebody outside, you take them to outpatient therapy. Then there's more intensive behavioral health services, the acronym is IBHS, some people might have heard that term, and that includes behavioral consultant services, mobile therapy, and it's a little more intensive than an outpatient service. The clinician would go to the home or community and work with the child in that environment.
And we always want to provide resources to our viewers, and the Barber Behavioral Health is such a great one in our community. There's some of their contact information for you. They have locations obviously throughout Erie and Warren County, but that's a good place to start. And Holly, we appreciate you coming in and having this conversation with us.
Thanks so much for having us. We appreciate it.